Hi, this is Sandy Dimiterchik with Sandy Says. I'm the Director of Community Engagement at Schizophrenia and Psychosis Action Alliance. Today I'll be interviewing Zahura Namibia for Black History Month. Zahura, could you please introduce yourself?
Hi, my name is Shahora. I have an African name and it has a meaning to it. Um, it's Shahora Nyano Olufumisa, Namibia, and my very African name is Okir Afoziki. I got this name during the African Rites of Passage ceremony with um, 16 weeks of training and over 50 years. So, um, Namibia is a country in Africa which had practiced apartheid and have now uplifted it through our struggles. And Nyanu is compassionate and tender one. And Namibia means goddess of love. And Olufumisa is that God has kept the children in my care. And I'm a peer support specialist certified, and I work out to help my people through my role model, which is my auntie. She started a awareness program doing affirmative action and gathered up the youth in our community and provided them with talent scouts, and they performed on. They had a TV program, one of the first Black TV programs that there were.
Well, that's very interesting, Zahura. It sounds like yeah, so what role do you play? You mentioned that you're a certified peer support specialist.
Oh, I thought you would never ask. I have duties of being a peer support specialist in all my phases of life. I have shown very evidence training to enhance my personhood and to be able to reflect on our youth and our aged and our middle class people.
Yeah, and thank you for mentioning your auntie. That's wonderful. Were there other historical Black figures that were your role models when you were growing up?
Well, it was once my father. He in our community they were um, taking the store owners were taking advantage of some of the people in our neighborhood, and my father, he bought a TV from the store, and he set up one of the first picket lines that they marched around the store. My father started out with his sign that he made, and we made signs and we picketed the store until the store owner um, heard what we wanted to say. And we're on the picket signs it says, "Ask me why I'm walking." So we was young. We was about 9 years old when my father did that.
Well, that's wonderful, Zahura, for you to see advocating. That sounds like it instilled a sense of advocating later on in your life as a certified peer support specialist. What do you think about the idea that Black people are misdiagnosed as having schizophrenia? I have a quote from Science Daily that African Americans are more likely to be misdiagnosed with schizophrenia, a study finds.
Well, I have a repeat that again. So you said that.
Okay. I wanted to know what you think about the idea that Black people are misdiagnosed as having schizophrenia.
Oh yeah, I read the article too, and I really think that that is and that's the truth, and I have experienced it myself as going into a mental hospital and coming out with the discharge that I had thyroid and thyroid problems, and it mimics schizophrenia. But when I told the doctors that I had saw after I was released from the hospital, they said that it was schizoaffective, and they bypassed the order, the proof that I had on my thyroid condition, and so they diagnosed me with schizoaffective. So yes, the trauma um, informed should be one of the screening SS during this time and age about um, our people experiencing um, slavery and systemic racism.
Do you think that there are a lack of resources for Black people? What about the APA finding that, according to the American Psychological Association, reported that in 2016, around 85% of therapists in the United States were white? The report also stated 4% of therapists were Hispanic and 4% of therapists were Black. How do you think that impacts Black people receiving services?
Well, I feel that um, since there's so many white people that's in therapy and help Black people, that we just have to pray to God and rely on a higher power that they make the right decisions and do the right things that's professional, and to learn how to be culturally competent in order to relate to the experiences that we've been through as a people.
And have you had a chance to read S&PAA's research paper on the cost of treatment or non-treatment of people with schizophrenia? What are your thoughts?
I had an intensive thought about that, and what I had came up with was that I'm coming up with a blank right now. Could we get back to that?
Yes. Do you think reclassification of schizophrenia as a neurological disorder will help people in receiving treatment and achieving and maintaining recovery?
Well, I believe that reclassification is the way to go to reduce stigma and to assess us in schizophrenia to our recovery. Um, yes, and so can well,
Okay. Well,
but
that's good.
you
Did
know,
you want to go back to the study that S&PAA did, or do you want to say whatever additional comments you'd like to make?
well, yes. Um, I wanted to read this part of this article I got from disparities within minority mental health care,
Okay.
and it's it's starts right. Have have you ever been tried to unlock a door that wouldn't open? At first you thought that it might be doing something, you might be doing something wrong. Maybe there's a trick to it. You pull the key back a little, doesn't work. You wiggle the key, it doesn't work. You keep trying, but the door always stays locked. After a while, you realize the problem isn't you, it's the key. This is what it's like for minorities trying to access mental health care. Difficult finding specialists, skyrocketing deductibles, and um, co-pays, but there are one added hardest to assess and the quality of care. So mental health is what's happening is that that we have a lack of availability, a lack of accessibility, and a lack of mental health services. Um, it says here that as shown in the most recent National Healthcare Quality Disparities Report, racial and ethnic minorities still have less access to mental health services than whites, and when they receive care, it's more likely to be of poor quality. There are many reasons why minorities aren't getting proper care. Here are some of them. So I'm just gonna name a few for the people that probably is trying to get care. A lack of availability is one problem. Transportation, the belief of mental health treatment doesn't work. Some people don't think it works. The belief, the high level of mental health stigma in minority populations, the mental health system weighed heavily towards non-minority values and culture normals. Okay, that's the main one. A mental health system weighed heavily towards non-minority values and cultural norms. Okay, racism, bias, and discrimination in treatment settings, language barriers, and insufficient number of providers who speak languages other than English, a lack of adequate health insurance coverage, and even for people with insurance, high deductibles and copays make it difficult to afford. Okay, so what we can do, we can encourage mental health organizations to include minorities on staff or boards of directors, write call or talk to legislators, um, both local and federal, to support efforts in improving access to and the quality of mental health services to areas. Be a spokesperson when there is opportunities to speak out on behalf of minority mental health. Share different information you learned about access and quality care of others. Try to be more open and understanding towards what minority communities might be experiencing that you might not. Whether you have personally experienced the challenges associated with minority mental health, or whether you are advocating for a better mental health system, um, anyone can help make a difference. Opening the doors to quality mental health care is for minorities to challenging is challenging, but we can all do our part in making the right keys for easier access and quality care.
And who wrote that article, Zahara?
Thank you. I thought it spelled out a lot of things that what we can do.
Who wrote the article? Was there an organization that you found that article?
No, it wasn't Sandy. This article was pulled up from Google. It's called Disparities Within Minority Mental Health, uh,
Okay.
by Larry Shu Shamsky, licensed LICSW.
Okay. Well, thank you so much to her for being on the call today. And thanks for joining us for Sandy Says. Make sure you check out other videos and subscribe to our YouTube channel by searching Schizophrenia Psychosis Action Alliance. Have a great day. Bye.